Hi everyone, welcome back to Little Growing Bones. It's a channel where we break down complex topics about children's bone disease into concepts that are easy to understand. My name is Judith Masazi, a pediatric orthopedic surgeon. Today we shall be talking about infection in children's bones, so stick around. So what is a bone infection? A bone infection, or osteomyelitis, happens when bacteria or germs find their way into bones and start causing trouble. It may sound scary, but it's a condition that doctors can treat easily if caught early. So you may wonder, how do germs even get into bones? Well, there are a couple of ways. Sometimes they enter through an open wound or an injury. Other times they travel through the bloodstream from another site in the body that has an infection. So this can be from like a cut on a different part of the body. It can be from an infection maybe in the throat or in the urinary system. All these can lead to infection getting to the bone. In children, bone infection usually affects the long bones. So for example, infections in the arms, infection in the legs. And you might wonder, why does this happen in children? This is because the growing skeleton has a rich blood supply, which makes it easier for bacteria to settle in. So when they settle in these areas of bones, then they have a chance to grow and lead to a full-fledged bone infection. Now let's talk about how to recognize bone infection. Here are some signs that parents should watch out for. The most common sign is pain and swelling of the affected area. This can be on the leg or the arm or near a joint. There's also redness and warmth over the affected area. The children could generally have a fever or just look unwell. Sometimes they have trouble moving the affected body part. Sometimes all the symptoms will not be present, but the children could just refuse to walk on that affected limb. So this is very important in the younger children, as they may not always have the obvious signs and symptoms of bone infection. So sometimes they just refuse to walk on the affected limb, and that should help the parent know that something is not okay. If you see any of these signs, it's important to visit the doctor as soon as possible. When the doctor sees the child, diagnosing osteomyelitis might involve either getting x-rays or even an MRI of that affected bone. Blood tests could be requested, and sometimes even through a small surgery, a small sample of the bone can be gotten to figure out what is causing the problem. So now let's talk about the treatment of osteomyelitis or bone infection. The good news is that most of the kids recover fully with the right treatment. Doctors usually start with some kind of antibiotics to fight off the bacteria. In some cases, the kids may need surgery to clean out the infection if it's quite severe.